Hormonal balance is one of the most significant factors affecting a woman's health throughout her life. Hormones act as chemical messengers, influencing a wide range of bodily functions and processes, from regulating metabolism to controlling mood, energy levels, and reproduction. Hormones are deeply intertwined with the body's ability to maintain equilibrium. As women age, hormonal changes occur naturally, particularly during key transitions such as puberty, pregnancy, and menopause. These shifts play a central role in determining how the body ages, impacting physical, emotional, and mental health. During the earlier stages of life, hormones such as estrogen and progesterone work in harmony to regulate the menstrual cycle, promote fertility, and maintain healthy bone density. Estrogen, in particular, is vital for protecting against a range of diseases, including osteoporosis and heart disease. It also supports skin elasticity and hair health, contributing to the youthful vitality many women experience during their reproductive years. However, as time progresses, the natural decline of these hormones begins to reshape the body's internal environment. This decline, while inevitable, can be managed with an understanding of how hormones influence the aging process and by taking proactive measures to maintain balance. One of the most profound hormonal transitions occurs during menopause. Menopause marks the end of a woman's reproductive years and is characterized by a significant decrease in estrogen and progesterone production. While this is a natural part of aging, the hormonal fluctuations that accompany menopause often result in a host of physical and emotional symptoms. Hot flashes, night sweats, mood swings, and fatigue are among the most common challenges. These changes are not merely uncomfortable, they also signal deeper physiological shifts that can affect long-term health. For instance, the decline in estrogen levels during menopause has been linked to a decrease in bone density. Estrogen plays a critical role in maintaining strong, healthy bones by regulating the activity of osteoblasts, the cells responsible for bone formation. Without sufficient estrogen, women become more susceptible to osteoporosis, a condition that weakens bones and increases the risk of fractures. This highlights the importance of addressing hormonal changes proactively, as maintaining bone health is crucial for preserving mobility and independence in later life. Beyond bone health, hormonal changes also impact cardiovascular health. Estrogen has a protective effect on the heart and blood vessels, helping to regulate cholesterol levels and maintain the flexibility of arterial walls. As estrogen levels decline with age, women face an increased risk of developing heart disease, which is one of the leading causes of mortality among women worldwide. Understanding this connection underscores the importance of supporting cardiovascular health through lifestyle choices such as a balanced diet, regular exercise, and stress management. The skin is another area where hormonal changes manifest visibly during aging. Estrogen contributes to the production of collagen, a protein that provides structure and elasticity to the skin. As estrogen levels decline, collagen production slows, leading to the appearance of wrinkles, sagging, and dryness. While these changes are a natural part of aging, they can be exacerbated by external factors such as sun exposure, smoking, and poor nutrition. By addressing these factors and supporting hormonal balance through healthy living, women can enhance their skin health and maintain a more youthful appearance. Mood and mental health are also deeply influenced by hormonal fluctuations. Estrogen and progesterone interact with neurotransmitters in the brain, such as serotonin and dopamine, which regulate mood and emotional well-being. During menopause, the drop in hormone levels can contribute to feelings of anxiety, depression, and irritability. These emotional challenges can be further compounded by physical symptoms such as disrupted sleep and fatigue. Recognizing the connection between hormones and mental health is key to developing strategies that support emotional resilience and well-being. Hormonal balance is not only essential for managing the physical aspects of aging, but also for optimizing cognitive function. Research suggests that estrogen has neuroprotective properties, meaning it helps safeguard the brain against age-related decline. It supports memory, learning, and overall cognitive performance by promoting blood flow to the brain and enhancing communication between neurons. As estrogen levels decrease, women may notice changes in memory and concentration, often referred to as brain fog. While these changes are natural, they can be addressed through interventions such as mental exercises, healthy nutrition, and in some cases, hormone therapy. One of the challenges women face in maintaining hormonal balance as they age is the influence of lifestyle factors. Stress, diet, physical activity, and sleep all play significant roles in shaping hormonal health. Chronic stress, for example, can disrupt the delicate balance of hormones by increasing cortisol levels, which can interfere with estrogen and progesterone production. Similarly, poor dietary habits can deprive the body of essential nutrients needed to support hormone synthesis and function. By adopting a holistic approach to health, women can mitigate the effects of these external factors and promote hormonal harmony. Another important consideration in hormonal health is the role of environmental factors. Exposure to endocrine-disrupting chemicals, EDCs, which are found in certain plastics, cosmetics, and household products, can interfere with the body's natural hormone production and function. These chemicals mimic or block the actions of hormones, potentially contributing to imbalances that accelerate aging and increase the risk of chronic diseases. Reducing exposure to EDCs by choosing natural, non-toxic products and limiting the use of plastics can be a valuable step towards supporting hormonal health. Exercise is another powerful tool for maintaining hormonal balance and supporting healthy aging. Regular physical activity has been shown to regulate insulin sensitivity, reduce inflammation, and promote the production of endorphins, all of which contribute to overall well-being. Exercise also helps manage weight, which is particularly important during menopause when hormonal changes can lead to an increase in abdominal fat. By incorporating activities such as strength training, yoga, and aerobic exercises into their routine, women can support both their hormonal health and longevity. Nutrition plays an equally vital role in promoting hormonal balance. Certain foods, such as those rich in phytoestrogens, can help support the body's natural estrogen levels. Phytoestrogens are plant compounds that mimic the effects of estrogen and are found in foods such as soy, flax seeds, and legumes. Additionally, a diet rich in antioxidants, healthy fats, and vitamins can support hormone production and protect against the oxidative stress that contributes to aging. Staying hydrated and minimizing the consumption of processed foods and sugar can further enhance hormonal health. For some women, hormone replacement therapy, HRT, can be a beneficial option for managing the symptoms of menopause and supporting long-term health. HRT involves supplementing the body with synthetic or bioidentical hormones to restore balance and alleviate symptoms such as hot flashes, mood swings, and sleep disturbances. While HRT is not suitable for everyone, it can be a valuable tool when used under the guidance of a healthcare professional. It is important for women to weigh the potential benefits and risks of HRT and make informed decisions based on their individual needs and health history. In recent years, there has been growing interest in the role of integrative and alternative approaches to hormonal health. Practices such as acupuncture, herbal medicine, and mindfulness meditation have shown promise in supporting hormonal balance and alleviating symptoms associated with aging. These approaches emphasize the interconnectedness of the body and mind, offering a holistic framework for promoting well-being. While more research is needed to fully understand their effectiveness, many women find these methods to be valuable complements to traditional medical treatments. Ultimately, the key to navigating the hormonal changes associated with aging is awareness and proactive care. By understanding how hormones influence the body and taking steps to support balance, women can empower themselves to age gracefully and maintain their health and vitality. The journey of aging is a natural and inevitable part of life, but with the right knowledge and tools, it can also be a time of growth, resilience, and self-discovery. Hormonal health is not just about managing symptoms, it is about embracing the body's changes with confidence and fostering a sense of well-being that extends into every aspect of life. Quality sleep is one of the most critical factors for maintaining health, vitality, and longevity, yet it is often overlooked or sacrificed in the hustle and bustle of modern life. Sleep is not merely a time of rest, but a period of active restoration during which the body and mind repair, rejuvenate, and prepare for the challenges of the next day. For women, the importance of quality sleep cannot be overstated, as it plays a vital role in physical health, mental clarity, emotional balance, and overall longevity. When we sleep, our bodies undergo a series of complex processes that are essential for maintaining health. During deep sleep, cells throughout the body repair themselves, and the immune system is strengthened, preparing us to fight off infections and illnesses. Hormones such as growth hormone are released, aiding in tissue repair and muscle development. At the same time, the brain engages in a sort of housekeeping, clearing out waste products like beta amyloid, which, if accumulated, can contribute to neurodegenerative conditions like Alzheimer's disease. This restorative process is crucial for longevity, as it protects against the physical and cognitive decline that often accompanies aging. For women, sleep quality is closely tied to hormonal health. Hormones like melatonin, cortisol, and estrogen play significant roles in regulating sleep patterns. Melatonin, often referred to as the sleep hormone, is produced in response to darkness and helps regulate the body's internal clock, or circadian rhythm. Cortisol, on the other hand, follows a natural daily rhythm that peaks in the morning to help us wake up and decreases at night to prepare the body for rest. When these hormones are disrupted, whether due to stress, lifestyle choices, or natural hormonal fluctuations, sleep quality suffers, setting off a cascade of negative effects on overall health. Estrogen, a hormone that is particularly significant for women, also influences sleep quality. Estrogen helps regulate the production of serotonin, a neurotransmitter that promotes feelings of well-being and relaxation. It also plays a role in maintaining the body's temperature regulation, which is essential for initiating and maintaining sleep. However, during menopause, the natural decline in estrogen levels can lead to sleep disturbances such as night sweats and insomnia. These disruptions can significantly impact a woman's quality of life and her long-term health, as chronic sleep deprivation has been linked to an increased risk of heart disease, diabetes, obesity, and depression. The connection between sleep and mental health is profound, and for women, this relationship is particularly important. Quality sleep is essential for emotional regulation and resilience. During sleep, the brain processes emotions, consolidates memories, and strengthens neural pathways. Poor sleep, on the other hand, can lead to irritability, anxiety, and depression. Studies have shown that women are more likely than men to experience insomnia and other sleep disorders, often due to hormonal fluctuations, caregiving responsibilities, or stress. This makes prioritizing sleep even more critical for women seeking to maintain their mental and emotional well-being. Stress is one of the most common disruptors of sleep, and its effects can be especially pronounced in women. Chronic stress triggers the release of cortisol, which can interfere with the natural production of melatonin, making it harder to fall asleep and stay asleep. Over time, this cycle of stress and poor sleep can lead to a range of health issues, including high blood pressure, weakened immunity, and weight gain. For women, managing stress effectively is a key component of improving sleep quality and, by extension, supporting overall health and longevity. Sleep is also intricately linked to metabolic health, another cornerstone of longevity. During sleep, the body regulates insulin sensitivity, which helps maintain stable blood sugar levels. Poor sleep, particularly chronic sleep deprivation, has been shown to impair this process, increasing the risk of developing type 2 diabetes, Additionally, inadequate sleep disrupts the balance of hunger-regulating hormones such as ghrelin and leptin. Ghrelin, which signals hunger, tends to increase with sleep deprivation, while leptin, which signals fullness, decreases. This imbalance can lead to overeating and weight gain, which are risk factors for many chronic diseases. For women, the interplay between sleep and weight management is particularly significant. Hormonal changes during menstruation, pregnancy, and menopause can affect appetite and metabolism, making it more challenging to maintain a healthy weight. Sleep, however, acts as a powerful ally in this regard. By promoting hormonal balance and supporting metabolic health, quality sleep helps women maintain a healthy weight and reduce their risk of obesity-related conditions such as heart disease and joint problems. One of the most critical aspects of sleep for longevity is its role in cognitive health. The brain's restorative processes during sleep are essential for memory consolidation, learning, and overall cognitive function. Without sufficient sleep, cognitive abilities such as attention, decision-making, and problem-solving decline. Over time, chronic sleep deprivation can increase the risk of cognitive impairment and dementia. For women, who often live longer than men, and therefore face a higher lifetime risk of developing conditions like Alzheimer's disease, protecting brain health through quality sleep is especially important. The link between sleep and immunity is another area where quality rest proves essential for longevity. During sleep, the immune system produces cytokines, which are proteins that help fight infection, inflammation, and stress. Sleep deprivation reduces the production of these protective proteins, making the body more vulnerable to illnesses ranging from the common cold to more serious conditions. For women, whose immune systems are often taxed by caregiving responsibilities and hormonal changes, prioritizing sleep is a powerful way to enhance resilience and longevity. Lifestyle factors play a significant role in determining sleep quality. Diet, exercise, and exposure to natural light all influence the body's ability to fall asleep and stay asleep. For example, consuming caffeine or heavy meals close to bedtime can interfere with the body's natural sleep processes. On the other hand, a diet rich in magnesium, tryptophan, and other sleep-promoting nutrients can enhance rest. Regular physical activity, particularly when done earlier in the day, has also been shown to improve sleep quality by reducing stress and regulating the body's internal clock. Creating a sleep-friendly environment is another critical step for improving sleep quality and supporting longevity. Factors such as room temperature, noise levels, and lighting can significantly impact the ability to fall asleep and stay asleep. Keeping the bedroom cool, dark, and quiet, as well as investing in a comfortable mattress and pillows, can make a world of difference. For women who experience hormonal fluctuations that disrupt sleep, such as hot flashes, using breathable bedding and wearing moisture-wicking sleepwear can provide additional comfort. Technology use is a modern challenge that can interfere with sleep. The blue light emitted by screens suppresses melatonin production, delaying the onset of sleep and reducing sleep quality. For women juggling work, family, and social commitments, it can be tempting to use devices late into the evening. However, setting boundaries around screen time and incorporating relaxing bedtime rituals, such as reading or meditation, can help promote better sleep and overall well-being. The importance of sleep for longevity extends to its impact on social relationships and quality of life. Sleep-deprived individuals often experience mood swings, irritability, and reduced patience, which can strain relationships with family, friends, and colleagues. For women, who often serve as the emotional anchors of their families and communities, maintaining positive relationships is vital for happiness and fulfillment. By prioritizing sleep, women can enhance their emotional availability and foster stronger, healthier connections. Finally, quality sleep is a cornerstone of self-care, a practice that is essential for women's health and longevity. In a world that often celebrates productivity over rest, prioritizing sleep is a radical act of self-love and respect. It is a recognition that rest is not a luxury but a necessity for living a long, healthy, and fulfilling life. By valuing sleep and taking proactive steps to improve its quality, women can empower themselves to thrive physically, mentally, and emotionally, paving the way for a life of vitality and resilience. The relationship between hormones and sleep is a complex, deeply interconnected system that impacts nearly every aspect of health and well-being. Sleep is a vital process during which the body repairs itself, processes emotions, and prepares for the day ahead. Hormones, the body's chemical messengers, play a crucial role in regulating sleep patterns, ensuring that the processes of rest and rejuvenation happen effectively. When this delicate interplay between hormones and sleep is disrupted, it can have far-reaching consequences on physical, emotional, and cognitive health, particularly for women who experience unique hormonal shifts throughout their lives. Hormones such as melatonin, cortisol, estrogen, and progesterone work together to regulate the sleep-wake cycle, also known as the circadian rhythm. Melatonin is a central player in this system. It is produced in the pineal gland and released in response to darkness, signaling the body that it is time to sleep. Melatonin levels naturally rise in the evening, peak during the night, and taper off as morning approaches. This rhythm is critical for aligning the body's internal clock with the external environment, ensuring that sleep occurs during the optimal time for recovery and restoration. Cortisol, often referred to as the stress hormone, has an inverse relationship with melatonin. Cortisol levels are typically highest in the morning, helping the body wake up and feel alert. Throughout the day, cortisol gradually decreases, allowing melatonin to take over in the evening. However, when stress levels are high, cortisol production can become dysregulated, leading to difficulties falling asleep or staying asleep. This imbalance creates a vicious cycle where poor sleep increases stress, and heightened stress further disrupts sleep. For women, hormonal fluctuations associated with menstruation, pregnancy, and menopause can add another layer of complexity to the relationship between hormones and sleep. During the menstrual cycle, levels of estrogen and progesterone fluctuate significantly, influencing mood, energy levels, and sleep quality. In the days leading up to menstruation, some women experience premenstrual syndrome, PMS, which can include symptoms such as irritability, anxiety, and insomnia. These disruptions are partly due to the drop in progesterone, a hormone that has a calming effect and promotes restful sleep. Pregnancy brings about profound hormonal changes that can also impact sleep. During the first trimester, rising levels of progesterone can make women feel unusually tired during the day, but they may also contribute to fragmented sleep at night. Physical discomfort, frequent urination, and vivid dreams are common complaints during pregnancy that further disrupt sleep. In the later stages of pregnancy, as the body prepares for childbirth, hormonal shifts, along with physical and emotional changes, can make restful sleep even more elusive. Despite these challenges, adequate sleep is essential during pregnancy to support the health of both the mother and the developing baby. Menopause represents another significant transition in a woman's life, where the interplay between hormones and sleep becomes particularly pronounced. As estrogen and progesterone levels decline, many women experience hot flashes, night sweats, and insomnia. Estrogen is known to play a protective role in regulating body temperature and maintaining sleep quality, so its reduction can lead to frequent awakenings and a decrease in the restorative phases of sleep. Progesterone, often called the relaxation hormone, also decreases during menopause, which can exacerbate sleep difficulties. These disruptions not only affect quality of life, but can also increase the risk of developing chronic conditions such as cardiovascular disease and depression. Beyond the reproductive hormones, other hormones like growth hormone and insulin also play important roles in sleep regulation and overall health. Growth hormone is released in higher quantities during deep sleep, particularly in the earlier part of the night. It supports tissue repair, muscle growth, and immune function. When sleep is fragmented or insufficient, the release of growth hormone is disrupted, which can impair recovery and increase the risk of illness. Similarly, insulin, which regulates blood sugar levels, is influenced by sleep patterns. Poor sleep can lead to insulin resistance, increasing the risk of developing type 2 diabetes and other metabolic disorders. Another key player in the relationship between hormones and sleep is the hormone ghrelin, which stimulates appetite, and leptin, which signals fullness. Sleep deprivation disrupts the balance between these two hormones, leading to an increase in ghrelin and a decrease in leptin. This imbalance can result in overeating and weight gain, which in turn can exacerbate sleep difficulties. For women who are more likely to experience hormonal shifts that impact appetite and metabolism, maintaining a consistent sleep schedule is essential for preventing these cascading effects. The connection between hormones and sleep extends to mental and emotional health as well. Hormones like serotonin and dopamine, which regulate mood and feelings of well-being, are closely tied to the sleep-wake cycle. Serotonin, for example, is a precursor to melatonin and plays a role in initiating sleep. Low levels of serotonin have been linked to sleep disorders such as insomnia and depression. For women, who are more likely than men to experience conditions like anxiety and depression, supporting serotonin production through quality sleep is a crucial component of overall mental health. Chronic sleep deprivation, often caused by hormonal imbalances, can have far-reaching consequences for cognitive function. During sleep, the brain consolidates memories, processes emotions, and clears out waste products. When sleep is insufficient, these processes are disrupted, leading to difficulties with memory, focus, and decision-making. Over time, chronic sleep deprivation has been linked to an increased risk of developing neurodegenerative conditions, such as Alzheimer's disease. For women, who often experience unique cognitive challenges related to hormonal fluctuations, prioritizing sleep is essential for maintaining brain health. Lifestyle factors can also significantly influence the interplay between hormones and sleep. Stress management, diet, physical activity, and exposure to natural light all play critical roles in supporting hormonal balance and promoting restful sleep. High levels of chronic stress, for example, can elevate cortisol levels, making it harder to fall asleep and stay asleep.